for today's presentation, we have Dr. Rachel Herlihy, our state epidemiologist, and Director Scott Bookman, COVID-19 Incident Commander. Dr. Herlihy, over to you.
Thank you. Good morning, everyone. So I want to start here where we normally do with our case trends. So this figure shows you that over the last 2 weeks or so, if you look at that red line, which is our 7-day moving average, our cases have been bouncing around a little bit, and this is not atypical for when we are in a plateau. The numbers tend to want to head up or down. And so when we're in a plateau, we often see these unstable numbers as we sort of try and get a clearer picture of what the overall pattern is going to be. If you look to the very far right of this figure, you'll see that we do see a little bit more clearly of a downward trend in just the last couple of days. So again, I think we're at a pretty unstable place right now in this plateau. Difficult to know if we're going to see a continued decrease in cases or if we could potentially see an increase in cases as we move further into the fall. Next slide, please. So I want to spend the rest of our time today talking about some of the trends that we are seeing in school-age children in the state. So this is a figure that shows you a comparison of rates that we are seeing in various pediatric age groups, so 6 to 11, 12 to 17, 0 to 5, and then comparing them to our overall adult case rates. So what you see in this figure, if you look to the far right, is that our case rates are highest in our 6 to 11-year-olds. Remember, that's the population that is not yet eligible for vaccine, followed by the 12 to 17-year-old population. And we have seen more of a decrease there recently. That is the pediatric population that is eligible for vaccine, and then followed by the adults. And then our lowest rates continue to be that 0 to 5-year population. And so the next couple of slides, what I want to talk about is what we're seeing across the state as far as variability in some of these pediatric trends and some of the factors that might be resulting in differences that we're seeing geographically in the state. So next slide, please. So this is a figure that just shows you pediatric case rates, and this is specifically looking at 6 to 17-year-olds, so school-age children, and comparing rates county by county for Colorado's 10 largest counties. It's obviously a busy figure, but I wanted to show plenty of examples here for Colorado counties just to show the variability that we're seeing right now. So you can see that the 7-day moving average case rate here is pretty variable. So we have counties like Weld County or El Paso County where that number is well above 40, and then other counties like Adams, Arapahoe, Boulder, Denver, where that number is 20 or below. And so again, just showing you that there is quite a bit of variability in the state right now in the case rates that we are seeing in children. We know that throughout the pandemic, there has consistently been variability across the state, knowing that different communities were hit hard at different times by the pandemic. But we also know that there are certain factors that are associated with increased rates of transmission or decreased rates of transmission. And so I want to talk about 2 examples now. Next slide, please. So this particular figure shows you a correlation between case rates and vaccination rates. And this is a figure that I've showed many times, looking specifically at all individuals that were vaccinated in the state and looking at case rates, hospitalization rates, or mortality rates. But this particular figure is limited to children that were vaccinated. So children 12 to 17 years of age, again, that's the population that's eligible for vaccine right now. And looking at their case rates, and that's shown in that y-axis along the left side of the figure, and then comparing that the case rate on the y-axis to the vaccination rate, which is shown on the x-axis along the bottom there. And so what you see is the same correlation that we see in all age groups, which is where we tend to have higher case rates. Those tend to be the counties where we have lower vaccination rates. Conversely, when we have higher vaccination rates, like we're seeing here with examples of Denver and Boulder, those tend to be the counties where we're seeing lower case rates occurring. So again, we see this clear correlation between high vaccination rates and low case rates. And that's true not just for the adult population, but also holding true for our children. So this could certainly be one reason that we are seeing differences in pediatric rates across the state right now. We know that those rates are going to be higher in counties where we're seeing lower vaccination rates among our children. Next slide, please. And this is an analysis that looks specifically at the use of masks in schools and looks at the difference that in cases that we are seeing county by county based on whether or not masks are in use in school districts. So specifically what we're looking at in this particular figure is an analysis of schools that started in Colorado between August 16th and August 19th. That's about 38% of Colorado's public school enrollment. So this doesn't include all schools. It's limited to those that started during that period of time. And it also excludes schools that had a change in their masking policy during that period of time to try and make the analysis pretty clear what the impact of masks in schools might be. And so if you look here, you'll see that those two lines that are shown in this figure, an orange line, which correlates to districts not requiring masks, and a blue line, which correlates to districts requiring masks in school, tend to be very similar to each other until you get to late August. The shaded period of time shows you when we would expect to start seeing the impact of a mask requirement in those schools. And so you see that starting in late August, we see those lines diverge, and you see that the lower case rates are associated with districts that are requiring masks in schools, again, showing a clear impact that masks are having in decreasing transmission in our school settings. I also want to say that we know that masks are, of course, not just important in school settings, they're incredibly important outside of schools as well. And so continuing to encourage parents to have their children wear masks at schools, even if masks are not required at school, but also outside of school. Masks continue to be important, especially for our kids that are not yet vaccinated. And with that, I'll hand it over to Director Bookman.
Thank you, Rachel, and thanks to everybody for joining today. I want to give a quick update on where we are in hospitalizations across the state. And as Dr. Herlihy talked about, with that unstable equilibrium where things go up and down a little bit each day, we seem to be in a similar place with our hospitalizations, as you can see here to the right of this graph, where we really seem to be going up and down a little bit, fluctuating between 875 to about 900 hospitalizations at any given point over the last few days. So still incredibly high. Equal to where we were during the first wave in the spring of 2020. Still working with our hospitals to ensure that they have the capacity that they need. And we'll go ahead and we'll look at the next slide to give a bit more of an overview of where we are. Before we get to that overview slide, sorry, I was out of order here. I want to really just reiterate that our hospitalizations are a pandemic of the unvaccinated at this point. This is publicly available information on our dashboard. 80% of those who are currently hospitalized are unvaccinated. And so I will take this time again to really encourage all Coloradans who have not gotten this safe and effective vaccine to take the opportunity now to get it. It's safe, it's free, it's easily available. It is the ticket that we have to ending this pandemic, allowing us to return to the Colorado life that we love. And again, 80% of those who are hospitalized are unvaccinated. So next slide. And so, as I discussed, pretty stable numbers between the 21st and the 22nd. Our ICU bed utilization seems to have gone down a little bit between the 21st and the 22nd. Our medical surgical bed use went up a little bit. So again, just a very unstable equilibrium here. We still have significant pediatric ICU capacity available, 17 beds as of today, and more than 200 neonatal ICU beds available. So a stable picture in our healthcare system today. Next slide. And then obviously, we know that there were more meetings today at the federal level to discuss booster shots for a larger percentage of the population. We want to ensure that we are prepared to meet any increase in demand associated with those booster shots and any others who may want to get their first or their second shot. And so we have expanded access at 4 community vaccination sites. Each of these sites has the capacity to do up to 1,000 vaccinations per day. We've got a drive-through site at the Aurora Municipal Center. We've got a drive-through site at Southwest Plaza. Down in Colorado Springs, we've got a site at Chapel Hills Mall. And in Commerce City, we have Dick's Sporting Goods Park. That's in addition to the more than 1,200 other enrolled COVID providers across the state. Again, this vaccine is free. It is easily available, it is safe, it is effective, and we want to ensure that all Coloradans have access to this vaccine in any way that allows them to get it as easily as possible. So, next slide.
All right, thank you, Dr. Herlihy and Director Bookman. We're going to move on to the media Q&A portion of today's presentation. A couple reminders here. You can always email us at media_info@state.co.us with any inquiries. We'll use the raise hand function here. You can raise your hand and we'll get to the questions in order that they were raised. And let's go ahead and stick with first questions first so we can make sure to get through everybody. If we have time, we can come back for additional questions or follow-ups near the end of it. Please state your name and your outlet before you ask your question. And let's go ahead and start with Jackie Lopez.
Hi, good morning. Jackie Lopez with Telemundo Denver. I would like to request additional information in regards to the school COVID testing. What's the protocol for the schools that are enrolled in this program? And if you guys could also confirm if you are planning to offer monetary incentives to the students that get tested. Thank you.
So we have a schools testing program that is funded at the federal level. We've got $173 million to fund this program. School districts or individual schools need to enroll in the program. And then once the school is enrolled, individual families make the decision to enroll their children. It's a once a week rapid test designed to do surveillance to catch cases early. And there is an incentive for individuals who decide to participate in it. And there's a one-time payment for enrolling and then ongoing incentives each time a test is conducted.
All right, John Ingold.
Yeah, thanks. It's John Ingold from the Colorado Sun. So question for Director Bookman. I know we've talked in the past about how in pre-pandemic times, Colorado hospitals had sort of evolved into these regional centers that serve more than just Colorado patients. They serve patients from all across the West. And I'm wondering at a time like right now where we're seeing a real demand for hospital capacity in the state, how does that end up impacting that? And is that a possible reason why our hospitals are faring at least slightly better than what we're seeing in some neighboring states?
So I think, top line, the reason our hospitals are doing better than hospitals in many other states is simply because our vaccination rates are so high in Colorado. And in the places, in the Southeast, other parts of the country where you've seen, ICU capacity overwhelmed, it has been, in places where there are significantly lower vaccination rates. Our hospitals work every day to ensure they're providing the best care to all. And they are still receiving calls on a regular basis to transfer patients in from out of state. We know that, from time to time, they do accept these patients as part of normal patterns of referral. But we do also know that, our hospitals have been, struggling with capacity from time to time. And they are really working to ensure that, they only accept transfers that they have the capability and the capacity to accept, which is part of the federal regulations.
KDVR.
Hi, yes, this is Alex Rose with Fox 31. We just want to get a better understanding of how protective natural immunity is. So to the state's understanding, how long does that immunity last for? What's the efficacy for that natural immunity? And why doesn't CDPHE post that on its COVID dashboard? Thank you.
Sure, this is Rachel. I can take that question. So we know that following infection, certainly reinfection can occur. We have data that has indicated that we have seen plenty of examples of reinfection here occur in the state. There are some challenges with that data, though, in that in order to identify a case of reinfection, you need an individual to have been tested first and then tested with their second case. And unfortunately, we know that most cases, many cases, I shouldn't say most cases, but many cases of COVID-19 are not documented. So individuals might not seek testing. And so because of that, we really can't use state public health surveillance data to really try and understand how common reinfection is. So that's certainly a challenge. But I would say one source of data that is important to look at would be our modeling data. We have a strong partnership with the Colorado School of Public Health. There was modeling data that was just updated and posted last week. And one of the things that they do look at in that modeling data is estimates of the percentage of the population that is immune. So you can certainly look at that data to try and understand what percentage of the population is immune here in Colorado due to prior infection versus due to vaccination. And so important sources of information available, but I think that typical public health surveillance data is not really the best data to answer those questions.
Great, John Daly.
Hi, John Daly, Colorado Public Radio. Thanks for taking our questions. I think there's a question for Dr. Hurley, although it could be for both. How would you characterize pediatric hospitalizations in the state? And are you seeing the case numbers that you saw represented in those counties? Have you identified whether you're seeing that in hospitalizations as well? So the counties with the higher case rates, are they also seeing higher numbers or percentages of kids that are getting hospitalized? And I had a follow-up after that, actually, real quick.
Sure, I can take that question. So we do continue to see that the vast majority of hospitalizations that are occurring in Colorado are among adults. We know that the hospitalization rates among adults are much higher than the rates among children. We do know, though, that hospitalization rates among children are going to follow case rates. And so while I don't have the data right in front of me, I would expect that in communities where we're seeing high case rates among children, those would be the same communities where we would see higher hospitalization rates among children. But keep in mind that those hospitalization numbers among children are small. And so there is going to be some variability and challenges that associated with interpreting small numbers.
All right, Ivan.
Good morning. This is Ivan with Denver 7. A quick question on modeling and then a follow-up after that if I could. Yesterday, we saw COVID-19 Scenario Modeling Hub come out with some data. They're saying that if everything goes as is now and if there's no other an infectious variant as Delta and children between the ages of 5 and 11 begin getting vaccinated in the fall, that this could be what we're seeing now, the peak, the worst of the pandemic, and we could see less cases going into next March. I wanted to know if this modeling is relevant here in our state and what you guys may be seeing.
Thank you. That's a great question. And so we are certainly working closely with our modeling team here, but also looking at national sources of information about modeling and forecasting to really try and understand what this fall and winter and even beyond might look like. It is a difficult time to try and make some of those projections right now. We are looking at a time when, at least in Colorado, we're seeing this plateau. It's difficult to predict if numbers are going to head back up or head down. And so that does create some uncertainty in some of the modeling work that we're doing right now and trying to understand what shorter term trends do look like. But I saw those same reports that you saw yesterday, and certainly encouraging news that it does look like if at this point, with increasing immunization rates and the percentage of the population that's been infected to date, that things are looking a little bit more positive than they were when those models were updated several weeks or months ago. So looking better, I would say, but I think that there is lots of uncertainty still. And I would say that, unfortunately, COVID-19 has surprised us many times throughout this pandemic. And I think that is possible that we could see other variants emerge. And I think that's the scenario that I'm concerned about, and continuing to watch our surveillance data and national and international surveillance data to look at what variants are emerging and spreading across the globe to see how that might change our risks over time.
Thanks, Doctor. Just on the school front, if you could, if we're seeing lower case rates among school-aged children where districts are mandating masks, is the state considering any sort of mandate for other areas, especially for those school kids?
So one thing I can say is that we did recently update our school guidance. And so we certainly do recommend that schools across the state, school districts across the state, implement mask requirements in their schools. So that would be, regardless of the transmission rate of cases in their county, regardless of vaccination status, the state does recommend masks be used in schools.
Right. Taylor? Taylor, are you available? Did you want to ask a question? All right, let's go to John Frank.
Hey, John Frank here at Axios. Two quick questions related. What are you advising on the flu shot when it comes to pairing it with a COVID booster? And what's your general outlook on the flu season, given what you've seen so far? I know it's early, but so far in the first few weeks here. Thank you.
Yeah, I can take that. I don't know if you want to talk a little bit about the pairing too, but we do know that it is okay to give the COVID vaccine and flu vaccine at the same time. So certainly encourage people who haven't yet received a COVID vaccination to receive both an influenza and COVID vaccination. Now is the time to start getting those influenza vaccines. At this point, we really don't know what the influenza season has in store for us. The Southern Hemisphere hasn't seen high levels of influenza transmission, but we know that our experience in the Northern Hemisphere can be quite different than the Southern Hemisphere. We also have an example of another respiratory virus, the RSV virus, that has emerged earlier than usual and has caused high rates of cases and hospitalizations. So I think it's tough to know exactly what this influenza season could look like. I think the concerning scenario is that we could see an increase in COVID. At the same time, we see an increase in influenza and potentially other respiratory viruses like RSV, and all of those together could certainly put some significant strain on our healthcare system. So I certainly encourage everyone to get their influenza vaccine.
All right, Taylor, are you available to unmute yourself? Did you have a question? Give him one more shot. All right, how about Vinny?
Yeah, hi, this is Vinny Del Judas at Bloomberg News in Denver. Taylor sent a message in the chat with his question if you want to go first.
Yeah, let's actually go ahead there. Taylor's been having a little bit of trouble. Scott or Rachel, could you provide more information about the hospitalization cases of those who are vaccinated? Are these largely patients who have not received any boosters or that fall in higher risk categories?
So I don't have a ton of detail on those hospitalized cases. We are actually doing some work looking at comparing hospitalizations among vaccinated versus unvaccinated individuals. At this point, the percentage of the population that has received booster doses is quite small. And so I think it would be difficult for us to really start to try and understand the impact of booster doses on hospitalizations, given that it's such a small percentage of the population at this point. But what we've seen nationally and in the research literature is certainly that booster doses for that immunocompromised population can have a significant impact in preventing severe disease and preventing hospitalization.
All right, let's go back to Vinny.
Thank you. This is Vinny Del Judas at Bloomberg News in Denver. Regarding children, since school opened, have there been any pediatric fatalities or pediatric ICU admissions? And I want to make sure I'm getting the overall data correct, that pediatric infections are up since school opened, but they are lower at school districts in Colorado that require masks. Thank you very much.
I'll have to get back to you on those exact numbers of pediatric cases, ICU admissions or deaths. So I'll have to get back to you on that. But yes, what we are seeing as far as pediatric trends, at least regionally across the state, we do see that case rates among the pediatric population that is vaccine eligible tend to be higher in those counties where the vaccination rate among those vaccine eligible children is lower. And then also we see that rates tend to be higher in school districts where masks are not in place.
All right, and John Daly.
Yeah, kind of following up on Vinny's question there, would you say based on the data and comparing not only the counties here in Colorado, but what the situation looks like in Colorado compared to other states, that it's clear that masks and vaccination are protecting Colorado's kids in a way that we're not seeing in states where pediatric hospitals are being filled up with pediatric COVID cases?
Yeah, so I think it is certainly notable that, for the last several weeks, even months, cases have been lower in Colorado, both in the adult population and in the pediatric population. And I think part of that is because we have higher vaccination rates. I think there's a clear association between communities that have higher vaccination rates and lower case rates.
All right. Thank you, Dr. Hurley and Director Bookman. Thank you all for joining. If you have any questions that were not covered in today's press conference or questions that you weren't able to get to, please email us at media_info@state.co.us and we'll get you a response as soon as possible. And with that, have a good rest of your afternoon.